My name's Wei C. I first discovered my cancer in July. First, I noticed something is wrong. I thought I kind of feeling pain in my mouth. I didn't even think about the cancer is not even on my mind. I was thinking maybe infection. So I went to see my dentist. I said, okay, give me some antibiotics. She looked at it and said, I will give you antibiotics, but it seems to be more serious than infection. So she asked me to go to see a surgeon and do a biopsy and make sure it's not something more serious. And I went in, sure enough, and then 2 weeks later, the biopsy result came back to tell me, okay, you have cancer. I said, what? It was horrible. My mind was blown. I couldn't really think for like a few days. I told my wife, she couldn't, the night that we talked about it, we couldn't fall asleep. It's really terrible. So just because I never had any problem. In general, I'm very healthy. I didn't have any problem before, and eat and exercise, everything. This thing just come up on the sky and suddenly never thought about this word. But anyway, and then I called the hospital in Boston. I came from Boston, so and try to make an appointment to see the oncologist and try to figure out what's going on and what to do with it. So we went through a bunch of the tests, PET scan, CT scan, and then figure out what to do. And then after all this, they came up with some, I guess, the treatment plan. But actually only one plan. There are no options. Basically, that you have to go do the surgery, and then maybe follow up by radiation and possibly chemo, depends on how bad they found after the surgery. I wasn't really against surgery per se, but I was really worried. I mean, I talked to them, I asked them what you can do before the surgery and after the surgery, try to minimize the chance of recurrence. Because I read after, there's kind of like 2 months since they were discovered and then they scheduled the surgery. So I did spend a lot of time to read a lot of papers, a lot on the internet as well, a lot of research paper, and found out in the kind of cancer that I had the chance of recurrence is really high, more like 30%. So I really wanted to ask them the question about those things, but they said that no, we are not going to do anything. We just do that's what we're doing. We are not going to do anything before, and we're not going to do it after. So that really made me worry. So I started and tried to search to see what else that out there. Plus the surgery itself is not, it's pretty big surgery because they want to take out the jawbone, the whole jawbone had to take out and replace it with another bone from the leg and put it on and then put a fitting tube in your body. Just that also scared me. So that pushed me to looking for other choices, see what other options I could have. Luckily, I found a post in one of the websites that posted by Tara, and she mentioned about her treatment with Dr.V. So I connect with her and asked her the question about that her experience and how she managed because I know that Dr.V is in California, and I asked her about how you manage the long distance, all those things, all kind of questions. And then after that, I feel comfortable enough, and then I contact Dr. V's office and schedule an appointment with Dr. V. So, well, we get an appointment, and over the Zoom, I asked my wife to sit with me and talk to Dr. V for an hour, go through all the things that we have. And after that meeting, we pretty much make the decision that we want to come over here to do basically do the treatment with Dr. V. That's how my journey to come here.
But that's a long way, huh?
It's a long way, and it's a long journey from the time that I discovered in January. I talked to Dr. V first time that was in September, and we made the decision like a day later to come over here. So I came here on September 9. I'm coming over, so that's how we start that treatment. So I don't want to delay. I want to come. And my surgery is supposed to be September like 15 or some day like that. So after that, made the decision I called, and basically it's 1 week. The same week I supposed to be in the surgery room. Instead I was here. So I asked her some question. I asked her basically, as I mentioned, that my biggest worry is not that much the surgery, because because the oncologists or my surgeons, they are great to do what they're doing. They keep saying that, okay, you should be able to, you should have a great outcome. I am no doubt about surgery part of it, but I really didn't like the fact that they didn't do anything to minimize the recurrence, because I think that was the most cancer patients would die not from the first time they have cancer, but really for the fun they got a recurrence. And so I asked Dr. V about this thing, and about the treatment plan, especially the following plan, and try to all the treatment like the cancer stem cell, the vaccine, all those things that I really think that would be giving you the best chance to minimize the recurrence. And plus, I told my wife that even if it doesn't work, then we can always go back to do the surgery, the traditional one. So then nobody knows that there's no guarantee that any treatment will work perfectly. So when I came here, actually, I was actually kind of surprised to see how the office set up. Really, it didn't really feel like you were going to like when I was in Boston, going to a big hospital, cancer center. You see the full of patients and doctor and running around. Here, it's basically just like a regular office. So you can't really, if you don't say anything, you don't feel that you are a patient at all. You're just doing it and sitting there, relax. You can do whatever you want. So that's really nice. And I think the treatment itself is actually pretty, I consider pretty mild. I would say everything looks like you don't feel much. And we first started some kind of we didn't start the chemo right away. We started mesotone and the other treatment first for a week, and then we started chemos. And luckily, I was really respond really well to all the treatment options that Dr. V prescribed, and especially after the chemo, after the first chemo, I noticed that tumor start becoming soft. For me, one advantage, one way that I could do, I guess, that I could feel the right way, because I can see it, I could feel it, because it's in my mouth, not inside my body. You had to wait for the scan or the fancy medical imaging tool to see what's going on. For me, I can see it every day. So that really nice to see that, like after first week, you can see that become very soft, and you can even see the tumor start shrinking. And after second week, then tumor actually shrink like 50%. And after the second week, I went in to see Dr. V, and for the consultation, she checked my tumor, and she was so emotional. I feel like she actually more excited than me. That tells you what she is. So she really cares about the patient. So she gave me a big high five and big hug. So we all very excited about all the progress that we made. And in 4 weeks, just keep shrinking. In 4 weeks, I mean, it's totally disappeared. The whole thing not there anymore. It started from like about 2.5 centimeter big tumor in your mouth, and then it totally disappeared. Nothing left. That's just amazing.
Yeah, that is really amazing.
Yeah, that's really, honestly, I didn't expect that kind of results. I would expect that it would be much longer to see that kind of result. But here we are. So I'm still working on it. I still have the 2 lymph nodes here, but it's much smaller now than it was. We are going to do the scan next week. So we'll see how big that is. But I can feel that one of them I cannot feel that anymore. The other one I can still feel it, but it's like much smaller than it was before. So that's was also good progress. I would say, for me, like when we first discovered this thing, I probably, like most of the patient, probably reaction would be like me, because the surgeon did a biopsy. He didn't really think, well, he's not a really cancer oncologist or whatever. He's just a regular oral surgeon. He tried to minimize it. Okay, he said, okay, just go in and cut it out. You should be fine, no problem. So the impression he gave me was, okay, I'll go in there and cut it out, and then take it out, and then ship it down. But that was my impression. That's why we are so rushed to the hospital and try to set an appointment, try to get it done. And then, but as time goes by, and when I spend more time to read it more about this disease and know more and more about this thing, also when we talk about all the treatment plan, instead of like simply cutting the tumor, in the sense that it's the plan they're giving me is a lot more aggressive and a lot more painful as well. So that made me pause and then look for the other options. I would say a lot of people probably would go through the same thing as what I've done. First reaction is just get it out, and then get it over. But I would say it would be probably wise to get a little bit more information and look at the options. I would say doesn't mean that's always the best option one way or the other. I guess that everybody would be different. I don't think there's one solution that would fit everybody else. But it's good to be getting more information and make your own decision.